Welcome to Springboard Studio's How-To series, where we talk about how to make healthcare more user-friendly. Each episode will cover a skill, process, or concept related to practical design thinking in healthcare, from abstract idea to its real-world impacts. Want to learn more about any given topic? Reach out to us at MGB Springboard Studio at mgb.org. Now, let's get started.
This episode covers design research in healthcare, how to tell user stories that will help inform design, and how to translate these user stories into requirements which will help you through later design phases. We'll also cover a quick case study to illustrate how design research can help inform the design of an intervention. Design research is a step in the design process in which you'll be interacting directly with your end user in order to understand more deeply who they are, what problems they have, and how they might feel about different solutions. The methods of design research that we found to work best in the healthcare setting are patient and provider interviews, surveys, observation, collective solution building, and usability testing. We won't talk about the specifics of these methods in this introduction. What's important to remember, though, is that the goal of all these methods, in the end, is to be able to tell a story about your users, what they need, and why they need it. When you are presenting your research either to senior leadership or to the actual product designers, these stories will stick in their head in a much different way than other kinds of data would. These stories humanize the end user and puts their problems in a context we can empathize with. In the next phase, when designers sit down to brainstorm solutions, they should be able to use your research to picture a real person using their product and how they might feel while using it. A simple way to tell these stories is by combining three elements: persona, user need, and user action. For example, Bill, a 72-year-old white man with diabetes and cognitive decline who lives alone in an apartment in Lawrence, Massachusetts, needs to track his medication intake in order to feel in control of his condition and avoid ketoacidosis. In this example, we know that Bill would have a use for a product or service that makes it easier for him to remember to take his medication. It would likely be helpful to conduct additional research to find out what forms of technology or communication other users in this demographic are most comfortable with. It may even be helpful down the line to show Bill what potential solutions the designers are prototyping and get more of his input then. Bill may be an amalgamation of a representative group of patients that you've spoken to, or you can use actual examples as long as you change identifying information for PHI purposes. Actual examples of single patients that illustrate a broader trend. We use these user stories to contextualize the problem you are solving while also suggesting what actions your solutions must facilitate in order to solve the user's problem. If you're conducting patient interviews, it can also be helpful to capture direct quotes whenever possible. There's something about putting the problem in the language of the patient that gives color and life to the problem and helps inspire more empathetic solutions. Whichever tool you use to get your answers from your users, at the end of this phase, you will want to translate your understanding of your users and user needs into requirements. Requirements are a set of guidelines that outline what your product needs to do to suit your users' needs. By following these requirements, your designers can make sure their solutions never stray too far from what the users told you that they need. If the above example refers to design research with patients, it is usually of equal importance to involve providers and other staff in your design research, especially in healthcare. For most of our projects, there are two users we need to understand before we get started on the solution: the patient and the provider. Whatever you are designing will most likely benefit the patient one way or another, but in order to be adopted and actually used by busy staff, it will have to be a clear improvement to their current method of doing things. It will have to fit in with existing workflows whenever possible. If you design something that is great for patients but not providers, it will likely not be implemented, and vice versa. In other fields, the scope of design research may be quite narrow. All a designer might need to know is how their customers interact with a website or an app, but in healthcare, the problems we're trying to solve often go much deeper than that, and often require some sort of behavioral change on the user's part. We are often designing services and products for very sick people who might be facing difficult prognoses and who might not always trust the health system. For that reason, we have to take a very sensitive and empathetic approach whenever involving patients in design research. Above all, we have to make them feel comfortable and listened to, and like their insights can make a difference for other patients like themselves. With that also comes an obligation on our part. If we are going to reach out to patients to volunteer their time and energy to help solve their problems, we have to make sure we actually incorporate their insights into our design. Otherwise, we're not being respectful of their time. Now let's talk about a real-life case where some simple design research changed the whole course of an intervention we worked on recently. For a larger MGB-wide initiative, our team was asked to perform design research for a service line that aimed to reduce inpatient hospital stays for chronic kidney disease patients transitioning to dialysis. Over the course of many patient interviews, we heard many stories of patients feeling overwhelmed and emotionally fragile in the aftermath of learning that they would need to go on dialysis. In many of the patients we spoke to, the devastation from this news would make them feel alienated and disengaged from their treatment, causing them to delay important medical decisions, and in some cases, to not follow up with their medical care. In some cases, this led to medical crises that could have been avoided. As part of these interviews, patients consistently highlighted that they wished there was a service where they could speak to other patients who had been through a similar diagnosis, so they knew what to expect and how to prepare themselves. In addition to a host of other business and clinical needs, peer support became a clear user need that we then recommended be treated as a requirement in the design phase of the program. This is the kind of insight we could not have gotten from simply looking at clinical or outcomes data. It was only by speaking to patients and listening to their stories that we learned enough about their emotional state to be able to address it. This was only a quick overview to design research. These conversations may sometimes feel a little difficult, and you might have to tweak your approach a few times along the way to get the information you need. While there are any number of tools you can use to help you prepare your approach and organize your insights, the most important thing is to just get out there and start talking to real people. You never know what you might learn or how it might be useful.
Thank you for listening to this episode in Springboard Studio's How To series. Want to hear about a topic we haven't covered yet? Let us know via email at mgbspringboardstudio@mgb.org.